So my topic title or PhD proposal title would be Can we enhance millennial learners' resilience at both undergrad and postgrad education levels through blended mentoring? My supervisors who have helped me through this journey is Professor Richard, he's sitting here, and Dr. Karen Connings. Very appreciate their support. Originally from Sudan and working in Qatar for the last 15 years, trained there. Mom of 5 wonderful kids, a clinician working at this nice hospital, a big tertiary hospital at Qatar. It's called Hamad Medical Corporation. Working at the internal medicine department as a consultant and teaching medical residents at the internal medicine residency program, and also an academic faculty at the 2 colleges there, College of Medicine at Qatar University and the Weill Cornell Medical Medicine in Qatar. My passion is on mentoring, and I started a mentoring initiative 2 years back, training faculty on mentoring concepts and benefits at my institution. This is a story of a PGY1. She joined my rotation. The first day was a hectic day in the block. She was looking sad the whole round. 2 or 3 hours we were rounding on new patients, and she looks very sad. I figured out that she had a problem from one of her colleagues, and she doesn't want to open up. So I asked her colleague if she needs any support to come to me. So first time to meet her, so she doesn't know me. So I took her to the coffee shop, and we sat for some time. She didn't open up, but I took the initiative to talk about my experience as a mom in the residency program and how I suffered and how I struggled, and everything there is a solution. She actually didn't tell me what was her problem, and I didn't know it in details, but I found that her attitude changed a lot in the rounds, and at the end of the block she came and she said, "You have provided me with a great support." I don't know what that support it was, but it really changed her attitude during the rotation. Stress and burnout, very rich literature actually. Burnout in medical students, 1 in 2, 50%. Some studies even showed up to 70%. Up to the latest publication, January 2019, there's very high stress and burnout among our medical trainees, whether undergrad or postgrad. Stress, as you know, and burnout will lead to determinate health outcomes, poor health. Even some studies showed suicidal attempts in 30%. And not only on the health of the medical practitioner or the well-being, but also on the patient care, on the empathy. One study showed that it decreased the empathy of the doctor to the patient, and even to the professional development of the trainee. So here must state that the risk is dose-dependent, and whereby there is a great exposure to the risk is associated with negative outcome and greater number of symptoms. Derby is an internist. She is passionate about the burnout and stress among trainees. She had many publications on that, and most of the studies or these outcomes came from her studies. Our medical trainees lie within the millennial learners, as you know. These are the generation which was born between 1981 and 1996. And in fact, these millennial learners have been shaped. This generation had been shaped by the expansion of information technology, by the social networking and the global connectedness. They have been actually blamed to be impatient, entitled, distracted, but it was found that they are actually innovative, deeply empowered. They have high autonomy, they are collaborative and overly socialized. So we can make use of this in 2 ways. Do we look into these millennial characteristics which can affect, maybe that's what makes them more prone to burnout and stress, and this is one of the studies, or maybe we can make use of their high technology experience or talent so that we can develop a program which helps them to reduce their stress and burnout. So what role was I when I was giving advice to my medical resident? Mentoring had been well established in the literature with its pivotal role in academic medicine and other disciplines. A mentor has been defined as a trusted and experienced advisor who has direct interest in the development and education of another individual. And we say development. And in fact, studies showed there are two domains of mentoring, which is the professional and the psychosocial part. And I made that circle big. The professional part, this represents the literature. So most of the literature is focused on the professional domain of mentoring, which is how many publications, what's career success, which specialty to choose, while the psychosocial part is less well represented in the literature. Mentoring is under the transformational theory. It's actually through the critical reflection and the non-judgmental can address the anthropological principle, and it is which is the richest source of adult learning. Resilience had been defined in the literature as it's the capacity of the individual to resist or manage adversity without developing physical or psychological disabilities, while burnout and stress has multifactorial, personal, professional, or environmental. It depends on your ability to have this coping strategy, or what we call resilience. So, the summary of the literature, which I found that there is strong still evidence of high stress and burnout among medical trainees reaching up to 50% worldwide, and that while mentoring is valued for its role in academic medicine, still its personal or psychosocial domain is not well represented. With having all these mentoring challenges, engaging the stakeholders in co-designing the mentoring program wasn't being found to be studied. And again, technology stands out as a driving force for engagement of the millennial learners, so why not to make use of it in our mentoring relationships? So we hypothesized that a co-created blended mentoring relationship can reduce the stress and burnout among the medical trainees and enhance their resilience. So for effective mentorship, a more frequent interaction with committed mentors and mentees is expected to be facilitated with the blended mentoring. Rather than have only a face-to-face relationship, why not to invite the technology to help us to have more interaction and therefore more way to reduce the stress and burnout of our trainees. Our first question is looking into what are the mentoring practices which happens. So my setting of all the 4 studies will be where I work at the Hamad Medical Corporation, where there are more than 700 medical trainees, residents, different disciplines rotate and receive their training, and undergrad where I teach in the both medical schools. So I will be looking into these, into what's the mentoring practice there. Is it only a checklist format, or it is actually a more of supervisory role than a true mentoring relationship? This will lead us to the second study, which is what are the millennial characteristics which affects the rate of stress and burnout and resilience among medical trainees. Quantitative and it will be a quantitative study. I will be using validated tools, and I will correlate that with the social characteristics such as the autonomy, the social connectedness, the use of technology, and the relationship between the faculty and the trainees. This will lead us to the third study. I want the trainees to determine what are the stressors and the milestones from medical students up to a PGY4 level. So I would like to look into what are the stressors, and do I need my mentor now? I'm going through stress because of the exams. So what are the periods which are really needed from the mentor? So what are the mentoring needs? And I would like to look into the mentoring skills. Using a concept map as a research tool, I will ask the participants to draw their own concept maps in a focus group discussions, where they will do it individually at the beginning, and then at the end will drive a main concept map looking into the stressors, the mentoring need, and the skills needed. Lead us to question 4, then. How having identified these stressors and the mentoring needs, so can we do a co-creation of a blended mentoring program in a form of 2 to 3 sessions which will be from 1.5 to 2 hours. And this will be samples from each organization or each institution. And these groups will invite the trainees first, and then the trainees with faculty, and then the trainees with faculty and the program leaders. So we'll have the voice of the three involved persons, and maybe technologists as well, so that we will discuss how to develop a framework at the end. And this framework will contain the matching process of the mentoring relationship. What are the meeting frequencies? What are the expectations? What technology need to be used, and how it will be used. And at the end, how we are going to evaluate our success of mentoring relationship. So it will be a co-creative. Having identified these themes, I would like also to involve those faculty and those trainees who are not there in the focus group. Again, I don't want to go away from the concept of the co-creation, so we'll do like a quantitative, sending questionnaires to all others, faculty, and identify these themes and take their also opinions on how to develop this blended program. This leads us to the second part of the research question. Having developed this program, I would like to test it. So the first is, what are the steps of implementation? Okay, and how the mentors and the mentees perceive it, both in a mixed method research, quantitative and qualitative. I will be sending questionnaires looking into the faculty and the trainees' perception on this relationship, and looking also on the frequency of interaction. I don't know which app they are going to use, but maybe screenshots will help to look into how frequent they communicated and what topics actually they communicated and used the app. Qualitatively, again, short interviews with some faculty and some sample from the trainees to know more rich information about how this works and how can we improve it further. And this leads to the last a larger scale study, which is a randomized control. Before that, we are going to deliver a faculty development initiative. Currently, there is a faculty development initiative which focuses on the professional part. We will introduce the resilience part in it. So we'll train the mentors on both how to manage, how to conduct a relationship where they can provide both support and provide career advice. So within this faculty, so we will divide them into 4 groups. A group who will be enrolled in a blended mentoring, having faculty who have been trained, and this is the first. And then there is no faculty development, but they are enrolled in a blended mentoring program, and this is a traditional with faculty development and without. Study outcome will be quantitative. Again, the validated questionnaires which we used at the start, we will be using them again at the baseline, at the mid, at the end, and 3 months after the intervention to see whether there is an improvement in the scores of these validated tools. And of course, rich information from qualitative data. We are going to do like focus group discussions with them to look into how they perceive this blended mentoring relationships. I just want to leave you if you didn't understand anything from my talk. So this is the message which I want from my PhD proposal. Rather than building the resilience and keeping our trainee alone, we need to help him. I would like to thank everyone who had helped me, my supervisors, and my site supervisors there, Dr. Maggie and Dr. Karen. Sorry, Dr. Maggie and Dr. Karma from US. And Dr. Abdulatif Al-Khal, he's the one who's supporting the program, the Dean of the Medical Education. And Dr. Toft, he is also the Dean of Qatar University, College of Medicine. And thank you and welcome any questions.
Thank you, Shireen.